Welcome back, everyone, to Conscious Caregiving with L&L, where we're tackling the tough conversations. As always, I am joined by my esteemed colleague and friend, Lori La Bey. Welcome, Lori.
Well, I love doing these shows and I love working with you. So I think this is an important conversation that we're going to have today.
I agree. We're talking about healthcare changes in seniors, and it's the two of us today. We're not going to have a panel, but we're just going to talk a little bit about our experiences and where we see things in the care industry this day and age. I want to start with you, Lori, and then for our viewers and listeners who may not be familiar with your story or your background, when did you first get into the senior care industry?
Well, really early on, but it wasn't in the field of dementia that I'm in right now. Originally, I was in the group home industry for developmentally disabled in my 20s, and I did that for about 10 years. And then I switched into real estate. And, you think, well, you wouldn't think seniors, but as soon as I stepped into that space, I saw this huge need for services for seniors, that they were being treated differently. Like, this is your last move, it's all downhill from here. And, who wants to deal with that? And then, I did that for 25 years. And then my mom, was having issues with her memory. She lived with dementia for 30 years. When I was in real estate, that started to show. And I went from just talking about helping people like transition and getting through a move and the benefits of that to talking about dementia and our story. And then in 2009 is when I formally stepped out of real estate and into this space of dementia. And that was because of all my colleagues and friends in housing saying, Lori, you need to be in this space. Everything's doom and gloom, and that's not the angle you're coming from. And we love working with you and you do a great job, but there's nobody doing what you're doing, and having the philosophy that you're having, and that voice needs to be heard. So at first I thought they were all nuts, because what do I know? I was just a frustrated daughter. And, here I am, years later, and I'm still going at it. I'm still talking with people and raising voices and trying to shift our dementia care culture. So, to that, I would just say to anyone, don't ever think you're not able, because you are. Every single one of us is able to make change. We just have to fully step into it.
Yeah.
And, we might dip the toe, but, don't lose your vision. Don't lose your power. And there'll be a lot of people that'll tell you you can't do it, but you can show them different.
Yeah. And like you said, you're still doing that today.
Yeah. Yeah. Never in a million years did I think I'd be in this space at all, and, but I love what I do, and I love empowering people and connecting them to services, products, and tools, and giving them hope, because that's something our family never had.
Yeah. Yeah, absolutely.
So Lance, why don't you tell the audience, how and when you got into this space?
Yeah, so for me, and I've shared this before, I was extremely, extremely close to my grandparents, probably almost as close as I was to my parents. And that wasn't a negative thing against my parents. It's just my grandparents on my mom's side lived down south. And so, like my kids today, I tell them how lucky they are. They can see grandma anytime they want because grandma's works full time for our company and she lives right by us. I didn't have that luxury with my grandparents. So from the time I was old enough, I would go spend, at first it was maybe 2-3 weeks. And then as I got into school and a little bit older, it would be the whole summer down there with my uncles and cousins, and just had a great time. And it got to the point where my grandmother developed dementia, unbeknownst to anyone in the family. And she came to live with us up here, which was fantastic. And for people that think differently, I would use this as a textbook example of why engagement, stimulation is so crucial. When we did pick her up, and I was the one that actually drove down to get her, and she came to live with us, it was a whole reversal in her cognitive abilities, her mood, everything, and you could really see a change. Well, but eventually dementia does progress, and as it got worse and worse, she had to go into a facility. And I would literally go and sit and just hold her hand. She became nonverbal, and I never will forget it. Aides would come by or nurses, and I'm there almost as long as they are for their shift, and they're like, aren't you just the greatest grandson? And they would actually compliment me and go and get another aide and say, look at this, which in a way is kind of sad that that's more of the exception than the rule, right? As we all know, sometimes loved ones go in these facilities and you might go on holidays or Mother's Day or Father's Day or on a birthday, but you're not there regularly with them. And I was holding out very naively the hope that I could maybe cure her, right? Just by being there and try to re-engage. And that left a profound impact on me. Well, it got to the point where she did have to go into hospice, and I remember it was my wife and I got married in October, and we had our first Christmas, and everything's wonderful. Later that day on Christmas Day, one of the uncles called and spoke to my mom and said, "You guys really need to come down. The hospice nurse wants to see us all together." So my wife and I, did our Christmas. She stayed behind, and my mom and I drove down, and it's like a 7-hour drive. And we had this meeting with the hospice nurse, and the hospice nurse starts talking about, hospice and what's going to happen and all these things. And, one of my concerns actually was, are you going to be medicating my grandma with morphine? And now, other than my mother, who was a nurse, the rest of our family are lay people. They don't know what I'm even talking about. And the hospice nurse, you could see, because I was only 23 at the time, maybe 22. She was very surprised by that question. Like, she did not have a good answer. And my thing was, I don't want to prolong any suffering, which my grandmother was not in suffering, but I also didn't want to expedite her demise and her passing either, and, she said, well, we'll only give it if necessary. Well, my mom actually, she stayed for a couple of days. I ended up staying for the next 3 weeks. I literally stayed right there at the hospital, and I was staying in a hotel across the street, but I'd be there from sun up to sundown. And, I finally had to come to terms with, she's not getting better. Like, this is not going to end well. And she did pass, but, my thing was, it just left a profound impact on the way it felt like the healthcare system viewed somebody because A, they had dementia, B, they are elderly. Like, I don't want to paint a broad brush with a broad stroke, but it seemed like there was no value placed on them as much as if I was in my 40s or 50s or 60s and I, was dealing with something. It was just almost like they were just trying to move it along, if you want to use that phrase. And then fast forward, years later, my father lives with my wife and I, and here I'm back in the role of trying to be there for him and do all these things while, I'm pursuing medical school. And so to answer your question, how long or why did I get into it or when? I feel like it started in my early teens because I always planned to be a physician. I never wanted to be anything but that. But then when I saw the need that families have with like the situation I went through with my grandmother, the situation we went through for 2.5 years with my father, albeit entirely different circumstances, I just had an epiphany, like, we need to do something to help these other people that are going through situations like us because the healthcare system isn't there to support them. They're not trying to connect them to resources. And if we're going through this and we're educated people and we're vibrant, healthy, what are people that aren't as fortunate going through? I didn't know about all these other resources out there. And so we decided to start a company where we help family caregivers, and a majority of it is seniors. So I would say probably in my teens is when I got into it, but not professionally speaking.
Yeah, it's kind of weird when you look back at your life, and I mean, I can go back even earlier, and I was always like fascinated with seniors. I was just really intrigued by them. I grew up in a family where my aunts and my grandma, I had three great aunts and a grandma, and they were all so different. And I would look at my friends, elders, and they were all the same. They were like little clones. I mean, they didn't go out of the box at all. But in my family, they were just like such different personalities and lifestyles and the whole 9 yards. So that was just fascinating to me. And I always learned so much from them, and I really appreciated that. So I always wanted to care for them because they always cared so well for me. I mean, it just seems so, now that I'm older, it just all seems so intuitive. Like I didn't have to ask when I needed something, they just were there. And so I think I kind of have some of that philosophy of giving back and wanting to be there for them and for others. Because the older you get, you realize, gosh, not everybody has, or was raised in a family like I was raised in,
So,
or was surrounded by certain types of people. And that alone is kind of a big awakening, or it was for me,
right.
as well on that too. One of the things that I really kind of want to dive in today is the changes in healthcare. You go back to like when you were a teen and then just how things progressed and what it was like then, what it was like now. And I sometimes have a hard time even sorting it out. Was it just it seemed easier and better because I was so naive to know there were these other needs? Or, because I think, I personally think our system has declined significantly, even though there's been some great little boosts and changes. I think it's a more difficult system to maneuver than what it once was. What are your thoughts on that?
Yeah, I think it's actually declined also. I'm hoping though, with like shows like yours and shows like this one, that, we're raising awareness and we're helping to educate people that are uneducated. And I really feel like they're uneducated because the healthcare system isn't educating them, right? We had 7 major surgeries for my father, and I would get very personally involved with the nurses, the surgeons, the doctors, as his advocate. And never once were any resources or anything provided to us or even mentioned to us. I can understand if you can't provide us with respite care. I get that, I understand that. But why can't you provide us with resources that could provide that sort of service, or give us the education that we need to best help take care of my father and take care of ourselves? And it never was there. And and I think it's about the same, Lori, because we deal with countless families to this day, and they're lost, and that's why I love doing conscious caregiving with you, and writing articles and doing All Home Care Matters. Like, I'm sure the same holds true for yourself, because we're filling that hole that the healthcare industry has made, and they're not doing enough to fill it. If they were, I don't know that we would even need to exist doing what we're doing. And when you encounter the countless families that we see, it's all the time. We have families that are dealing with situations with adult protective services, and families that are dealing with, short-term rehab, or Medicare won't pay because they've exceeded their limit, all these situations. And they're calling our company looking for help and support. Where's that role that healthcare is playing to help fill that void? And I don't know what it will take for that to change.
Yeah, it really has changed. I think, when I was younger, I didn't know, and so, I would ask a lot of questions, but also when I was younger, and I'm 65, so go back, 45 years, when I was really involved in all of this, people talked to one another.
Yeah.
I mean, it wasn't automated systems, it wasn't so much emails, it wasn't go to the portal and have another password. It wasn't being text with, like, I get texts now. I'm caring for a couple of people, and even the pharmacy will go, your prescription, and then it gives me 3 letters, is ready for, well, you know what, these guys are taking a lot of medications, and sorry, I don't have them all memorized, and is this something we really need, or have they put it on an automatic refill and we don't really have to go pick it? And so I have to go back and do all this research because there's such a big disconnect with stuff. And so to me, part of it is we have depersonalized things so much. The insurance companies, and I'm going to lay this on them, have micromanaged everything so severely, and the hospitals, the clinics, they have to comply. They don't have a choice in order to get paid because people don't have the money to do anything else. And so it's really sad. And I really truly believe the insurance companies have to step up because, you know, healthcare is losing staff.
Right.
Now you add in, what the president's doing with the DEI stuff and the budget cuts and in NIH, losing money. All of those things are going to be huge factors that are going to impact our healthcare even more. And, I'm not saying this from, a Trump versus Harris type thing. It's not about that. It's just about how we function and how we approach things. We have to, I don't care who we are, if we're going to be effective, we have to look at big picture and we have to look at impacts before we make decisions. We need to know the ripple down effect. And no one seems to care about who the heck's paying them in the first place to even be in business. And so, I find that probably the most frustrating. Though, there's been some good things. We've had, more cures and more therapies. You're hearing more about support groups. You're hearing more about patient voices and advocacy, just like you and I and others. And I mean, I know when I got in 2008, the patient wasn't even included in the conversation, and the care partners, they were maybe listened to but not really.
Yeah.
It was just a really bizarre process. It's like, how can you tell us how to live our lives when you've really never stepped in our shoes? You don't know the realities of whatever illness that someone is dealing with. And, certain areas got more funding, heart disease and cancer and diabetes. And then you have all these other ones that are kind of clawing at trying to get the money and trying to get in place some of the things that have played out. Like I look at breast cancer, you go in for a mammogram nowadays, and I mean, they're giving you the warm, lavender washcloths to calm you down. They got the music in the background,
Right.
and they know to greet you by name and have a little conversation. I mean, it's super, super personalized. And yet you don't get that typically when you go into the doctor's office. It's give me your card, we'll scan it in. You get the same questions over and over that frustrates people. Like, okay, you had me do my early check-in. So I've done all of this already, but you're still going to do it again. You're going to do it at the front desk and you're going to do it when I get in the room. That is not efficient
Right.
in my eyes at all. And it's wasting precious time that the patient could have to talk with the doctor or something. What are some of the things that you've seen?
I've seen in my professional opinion, I've seen a dramatic decline in, support staff services at doctors'
Mhm.
offices and at hospitals. I was just, as you were talking, I was thinking about that early check-in. We have a client and they do the early check-in, they get to the appointment, and like you said, they have to basically do it all over again. So it's almost like, what is the purpose? But in their situation, they needed to get a refill on a prescription and they had to
Mhm.
go in, do it in person, no more Zoom. And the doctor said, no problem, I'll write a prescription. Well, their pharmacy didn't have that prescription strength in stock. They had half the strength in stock. So basically, you'd take 2 pills versus the one. Very simple, right? So the pharmacy called the doctor's office because they're, able to do that as the pharmacy, and asked if they could correct the prescription. It took 4 days, Lori. 4 days. Our client, the doctor's patient, called 4 days in a row. The pharmacy called 4 days in a row. It took 4 days for the doctor to simply rewrite the script for the reduced strength and take it 2 times a day rather than 1 time. But my point is, I don't put that on the doctor,
Mhm.
because every time this, our staff was telling us they talked physically to someone at the office. The pharmacist, supported that and said they talked to him. Something so simple and so easy to remedy, but so this person went without their prescription for 4 days because the support staff couldn't get that taken care of. And every time they talked to them, they said, yeah, call your pharmacy later today. We'll have it in for you. It took 4 days of calling. And,
Mhm.
so I think, you mentioned something that I think is so powerful, and that's personalized care.
Mhm.
For myself, that's why I wanted to go into healthcare, is because I enjoy helping people. That's kind of like, my gratification. And they they just have lost that somewhere along the way. I
Mhm.
feel like it's more of a factory mentality where, patients are a part going down the conveyor line and you just go from station to station. Nobody cares what the part is or what it's for. They're just there to do that sole purpose or sole job. They don't want to step outside of the box. They don't want to go above and beyond. But when you're dealing with something so personal as healthcare, I don't think anything really should be above and beyond.
Mhm.
Some of the doctors that I hold in the highest esteem that I know personally, they're rated the highest in the state because they haven't lost that personalized approach and that personalized touch. And they'll mention a doctor or a practice and they'll say, I wouldn't even send my worst patient there. That's how low they feel about that. They said they don't care. They're just there to collect a check. And that's coming from very esteemed, physicians in Michigan. And I just don't know why we've lost that personalized approach. And I get if the doctor has a room full of patients waiting and all this, and insurance has guidelines for how much time is spent, but it only takes a moment to say, how are you today? A smile, call them by name, and the support staff have a lot more time. So,
Mhm.
especially for our elderly who don't have advocates with them, or maybe their advocate is, elderly also, and maybe their memory isn't as sharp, make sure they understand everything before they leave.
Mhm.
Do you have any questions? Do you have everything? Is there anything you need a refill on? Just those small, small things, are so easy to do, but it seems like they're not being practiced.
Yeah. Well, you had mentioned about, getting the labels and the prescriptions correct. I went in just yesterday and with somebody, and I said, I really want to go over all these medications because what the bottles say and what we're doing and what they've been doing forever, and I've just stepped in the last few months, isn't correct. Like, should we really be taking a baby aspirin every day? Because her husband, his cardiologist said, well, that's kind of a falsehood now that that's going to help. And
Right.
she said, well, but for him, it could hurt, but for her in her situation, I would recommend that. I'm like, okay, so that shouldn't be for our notes and as is, a PRN. But there were other ones where it was like, well, this should be discontinued, and it came through with the test result when I went in the portal, and I'm like, she hasn't been taking that. I mean, that was discontinued ages ago, and I went in. She's seen both doctors. We went in and we updated all of that stuff, but apparently it didn't get updated. And I thought it got updated on the portal even when I went in there. And so I don't know if the changes really took or not, but it's complicated. It's
Right.
it's and it's so much more difficult if you are a caregiver, needing all of the paperwork that they have. Like, they should give you a bundle of paperwork. Like, this is everything you need to have signed. But instead it's a one-off thing.
Right.
You need to get the healthcare directive done that not everybody has done, and then they really prefer you use theirs versus somebody else's. And then you can go ahead and bring in your power of attorney, but they still want other signatures for, oh, I can talk to you in the phone, or you can be part of this conversation in the clinic. Oh, you want access to the internet? Oh no, that's a whole nother form. It's like, why are they making it so difficult? Put it all on one form like you do for a power of attorney and just check the boxes on those things. I mean, it's just the process of things, the hours in terms of time. I was on with an insurance company checking on a couple of things yesterday, and I lucked out and I got a hold of somebody right away, and I needed to check for both of them, and we got through all of it. And then I called back because I had another answer. I was on the phone an hour on hold. And then I'm like, okay, I'm just not going to call yet. I, I got to hang up. But it's like, that is so frustrating if you're closed, or if, you don't have staff, or tell us how long it's going to be. Those things are at least helpful, to know. But just to have somebody on the phone hanging and hanging and hanging, and then, if the notes don't get in correctly and you call back and it's like, no, that's not the conversation we had. I mean, it's just, it's crazy making the hours and hours that it can take, where I didn't feel that before. And I have to look back and go, okay, was I this involved? And I'm like, yeah, I was, but it just wasn't this hard. And like you had mentioned, people, when there was more of that personal contact, they would tell you about other services, even if it was outside their circle, of insurance coverage. They would at least let you know if you asked. But a lot of times we don't even know to ask, because we don't know it even exists, and to me, that's got to be one of their jobs. Or they need to coordinate. I don't care if it's a social worker or care navigator or what the heck you call it. But, if the doctors don't have time, and I get they're probably the most expensive ones, in terms of who the insurance is paying for, that needs to be part of the process. Otherwise, they're going back in again, and, now they're even charging you, or telling you they could charge you if you write a message in the portal,
Oh, I
you
haven't
know,
seen. Is that right? Wow.
Yeah. Yeah.
See, that's yeah.
they'll charge the insurance company. But it's like, you tell us to instead of calling, and like when a prescription runs out. Had the same issue recently, where they called the doctor, never got a call back, and said, you're going to have to call the doctor to get the prescription updated, because they're not responding. And I think in that particular situation, I understood it, because it was from, a transitional care discharge person who wrote the prescription. And so they're probably like, I don't even know who this person is, but I'm not going to carry them on my plate. They need to go back. But nobody called to say that transfer, it needs to go back over here, to get that refill. And even when and I've mentioned it to the pharmacy, and like, well, we can't really call them because it was under this doctor's name. And I get that, but no one's really telling people about those steps. And a lot of time gets wasted. And I mean, it can be deadly for some people not to get their medications.
Absolutely. Absolutely. Just to touch on that, it's not necessarily medication related, but, we had a lady not too long ago. She missed 4 or 5 of her doctor's appointments in a row. And this is over like a 4 or 5 month period.
Mhm.
The doctor never contacted the family to say, your mother keeps missing these appointments. Is everything okay? Didn't even give it a thought. Then the woman ends up going into the hospital, and
Mhm.
she loses an unbelievable amount of weight within 48 hours. It was just dramatic. Doctor didn't seem to think anything's wrong with that. And, this is her primary care doctor. And anytime the family would speak with the primary care, he's like, I'm not too concerned. But I mean, I think you should be a little more concerned, even if you're not a lot, be a little, because, when you miss 4 or 5 appointments in a row and you don't call or any, like
Yeah.
something is wrong. And then
Mhm.
you go in the hospital and you have dramatic weight. We're talking like 50, 60 pounds,
Wow.
something is significantly off, and the person lives alone,
Yeah.
so that's where I think the doctor, if nothing else, just on the air of caution, should consult with the family. Say, you might want to consider, mom moving into a facility, or mom getting some help at least, every other day, if not every day, because I'm seeing a lot of significant, cognitive changes, physical changes, medications. She can't keep them straight. All of these factors are leading to a disaster, right? And I
Yeah.
feel like it goes back to like that personalized approach. You know,
Mhm.
you need to get a little more involved rather than just, how are you? Everything okay? Any changes? All right, we'll see you back in a couple of months. Ask some questions, especially when it's an elderly person with known cognitive changes and physical changes.
Yeah.
The families are really having to become more of the, advocate in the truest sense to the doctors, not even necessarily for their loved ones, because their loved ones don't often know that there's anything wrong, right? And the doctors, they're taking histories and assessments off of somebody with cognitive changes. They're not necessarily always going to get factual information either. You know, that's like we recommend the families now, Lori. I don't know what you feel about these, but you know, a lot of your pharmacies now will do the prepackaged blister packs for your medications. Now they won't do, you know, opioids or narcotics because they aren't able to, but you can still get the script, just not in the blister pack. But you know, some elderly people take, you know, 6 to 12 different medications every day. And not only is it hard with your fine motor skills, right, with arthritis and different things and your vision, but like you just were finishing saying, it could be very consequential if you take the wrong med or you miss a med. You know, putting them in those little packages, all you got to do is tear it and take them. You don't have to sort them or anything. But just little stuff like that, you know, I feel like physicians could recommend and suggest.
Yeah, I just I so agree with you on so many levels. It just there's got to be a way to ease this process. What I found though with pulling the families in
Mhm.
is that they won't, because they've never addressed having the paperwork signed to allow them for HIPAA. So
Right.
then everyone just flatlines and
Yeah.
pretends like there's not a problem. We went in, now I'm dealing with somebody who has undiagnosed dementia.
Mm.
And I had talked with the doctor ahead of time because they can listen, but they can't give information. Told them what was going on and that caregiving, you know, people had changed and I'm going to kind of be in charge of this, blah, 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 blah. Gave her all the background. We go into the doctor's office and she's there. It was her husband and her and myself, and we were all going to go in to the doctor's for this conversation. And the nurse comes out and, you know, calls for Maureen. And I said, oh, we're all coming. And she looked at Maureen and said, they don't have to come in. Now, she's got, I mean, there's no question that she's got dementia. And so they go off. They would not let us in the room. They're not getting any accurate information. They're getting everything is fine. Yes, I'm taking all my meds. No, you're not, because I'm calling every morning to step you through exactly how to do your insulin. And Tom's double checking it and calibrating it. And I mean, it's a very slow, methodical process. And what day is it? And then, you know, reassuring. And none of this is being told. And the doctor comes out and she's like, I'm sorry, you can't come in. She doesn't want you. And I said, she was fine. I said, we just had another appointment with another doctor. We all went in. I said, this is not, she doesn't want me in or she doesn't want her husband in.
Right.
This is your staff not reading a file and not knowing what they're dealing with. I was so PO'd. I mean, I was livid. I was just livid. The doctor came out again and kind of then asked some questions. And she says, well, you know, we really have to listen to the patient. And I'm like, I get all of that, but we have the healthcare directive. You know, we had this conversation and we were just in again and all of us met and things went really well. But you know, it's difficult, especially when you're dealing with some cognitive issues, and maybe it's not even cognitive issues, it's just pride.
Right.
None of us want to admit that anything is wrong. And you know, when we're in denial, we sure as heck don't want to share that with everyone else. You know, so the whole psychology of the appointment, to me, they should be encouraging people to bring an extra set of eyes and ears, because there's a lot discussed. Notes have to be taken, follow up needs to be made, and that would make everybody's job easier, and it would make their life, you know, much smoother, and it would create this team effect. But they're kind of anti that, and I think that all came into play when HIPAA came into play. They lost their common sense in terms of what is really needed for them to live healthy. And I get that there are certain people you don't want knowing what's going on. I respect that totally. But I think they're working against themselves because they're not using common sense. They're just whatever the orders are that are coming down, no one's really questioning it. It's just like, okay, we have to change, we have to change. And upstairs, who's throwing the orders down hasn't lived the process and doesn't understand the reality of what is going on. You
Ab-
know, I was doing I had a client actually that asked me to, and this was really interesting, where a doctor, was doing a Zoom meeting, and they were doing a neurological assessment summary, and they had the PET scans and stuff on the screen, and I had to watch it 4 times, and I know what they're talking about. The family like didn't have any knowledge at all, but he was going so fast, and he had like the screen was black, and then you had the X-rays or the scans, and he had just a really fine red arrow against black, which elderly people can't even see for the most part. It should have been thick, it should have been yellow or white, and he should have gone slower, and you could just, if you could see it, all you saw it was whipping across this thing, but you couldn't, it was so difficult to track. And then even the verbiage that was being used wasn't explained. They don't dumb it down so we understand what they're really talking about, for families and individuals. And that's critical, because if people don't understand what you're saying, you're not helping them.
Exactly. Yeah. 100%. I feel like doctors are overworked right now. I feel
Mhm.
like they are so confined within the guidelines that insurances allow them to be. And, some of it I think they can help. Some of it I think they're just trying so hard. So they know Mrs. Jones is out in the waiting room. I need
Mhm.
to get through this so I can get to her, or my whole day is going to be backlogged. I feel like, I understand HIPAA very well. We exercise it here at our company. But when you, like you're mentioning, you have the health directives, you have all the documents, there's no legal reason they shouldn't have allowed you into the room,
Mhm.
other than
Yeah.
maybe they just didn't want you guys in there because it would prolong the appointment, maybe.
Yeah. Well, and I think it was because this particular person she'll take a lead, and this is real common with someone with cognitive impairment. If you seem upset or stressed, they'll take that on. She was perfectly fine. And then it was like, no, no, you don't want to. And I saw her face, and I saw her talk to her, and she's like, no, you're not allowed.
Wow.
She doesn't want you in. And I'm like, we've worked really, really well together. And then, when we did come in again this next time, I think the doctor was shocked at how well we all got along. And, it's just really, it just doesn't have to be so complicated. But like, I can tell, as a family member now, stepping back into this role, and I think I've purposely been put in this role with a couple of friends and a neighbor, and then family members, to kind of reawaken me to where things are at and what the real needs are out there. Because I see them, and my neck and my shoulder gets tight with everyone else's, and just like, oh, I need a massage or an aspirin or something, because like my head's ready to pop off,
Right.
because it's just it's this chug along, chug along, chug along. We had I'll give another example. We had one of them needed to get on a patient assistance program, because the medication was like $800 a month, and they just can't afford that. And so you fill out this form. It's not a big thing. You go to your pharmacy, which I didn't even know you could do this. You can go to your pharmacy and get printed out all of your medications for the year. And I'm sure a lot of people on Medicare and stuff know all this stuff when you go in to pick your plans, but I never knew that prior. I do now because I'm old enough. But so we get that, we get their 1040s, we fill out couple pages, just real basic information, drop it off at the doctor. The doctor has to fill out their portion,
Yeah.
and then they're going to send all this information in. Well, last time we did this last year, it took like 2 or 3 days. And I know it can take up to a couple of weeks, So I wait, didn't hear anything. I reach out, and they're like, no, we haven't heard anything. And I said, well, you faxed it all in. I dropped it off in a manila envelope with written instructions on the outside and on the inside. All of this has to go, plus you have to finish your portion. Well, I'm seeing here there's no receipt that it ever really got faxed. So I know we faxed it, but we never got a receipt. And I'm like, well, then it didn't go through. So she refaxed it again. Wait and wait and wait and wait and wait. Well, then they said no, they didn't complete all of the information on the forms. So it was pre-filled out what I gave her, but the doctor still had to put in the prescription and their number for the clinic and for him, and a couple other minor things. That none of that got done. And my error was I assumed they knew how to fill out their form.
Right.
So she faxed this whole package in and it's incomplete. So then we have to go back and do it again. And so then she refaxed it in. So then I call again. It's been another week and a half, still haven't heard. And now he's denied. And I'm like, well, how can he be denied? Well, we didn't have any information. He checked that box, or we could do a soft credit check. And, it says his income is this. And I'm like, that's not his income. I had all that was there. And so they must have shredded it. And I can understand where they maybe don't want it in their file, the clinic. But then she didn't realize that wasn't there. So apparently they never even got this information from the get-go. So now we have to do it again. I have to resubmit it. And I used to have a fax at home. I don't have a fax anymore because I do everything with PDFs, but you can't submit PDFs via email. So I go over to FedEx and I almost fell over. I have like 30 pages to fax, and they want like $2.20 a page to fax this thing over. And I'm like, we're not using any ink. We're not using any staff. We're not using any toner. I mean, it's the wheel on the machine pushing it through. That's about it. And I was just disgusted how much they wanted me to pay. And I'm like, I'm not paying that. This is being done for a person who needs assistance. And so now I called back in again because it's like, I don't want to go back to the doctor again. I've been there 3 times with this information.
Right.
And I don't have trust, and I can't get to the gal who did it the time before, because you get who's there. So now I can make a PDF and I can upload it to a portal. And so it's like, okay, that was a lot of time to learn that I could do it that way,
Right.
But it's like anything else. You want everything packaged together because when it gets piecemealed, it breaks down. And I see a lot of that kind of piecemeal thing in the system. But yet, boy, do you appreciate, or I sure do, good staff when you get them. That's, personal, and, and it just eases the patient's mind and heart while they're sitting there, that somebody called them by name and said, how are you doing? Or remembers they have grandkids or something was going on in their life. That takes 2 seconds to do.
So simple. So simple. And I think it sets the tone for the appointment, right?
Absolutely.
I mean, I personally, like whenever I've had a doctor's appointment, I tend to remember the staff in the office more than the encounter with the doctor.
Yep.
Oh, she's so nice at the reception window, or is she having, an attitude because you're interrupting, her internet surfing or something, It's just the staff are part of it. They're part of the appointment. And I know one of my friends who is a doctor, he said he values his staff almost more than his nurses because those are the people that the patients are going to have the most interaction with. When you're making your new appointment, when you're checking in, when you're checking out, if you have a question, all these things, when you're paying your copay, all these things are with the support staff.
Yeah. Well, the other thing that I have found frustrating, and I think we all kind of appreciated the automated systems in the beginning, when they first came out, it was kind of like, oh, we don't like it. But but we could maneuver it and it was pretty simple. Now they've gotten so complicated with 3 layers deep,
Yeah.
but with many of the clinics, they repeat the same stuff that was on the first one. And it's like, cut me to the chase here. you know and the other thing that I just found, and I struggle with this in healthcare, and I'll use dementia as an example. Everything used to be called Alzheimer's, and then it was dementia. Well, now people don't like dementia. Now, it's neurodegenerative. I mean, it's just this constant change that confuses the public, because I believe we can educate people on the differences and stuff, but there's always someone who's not happy. So now they have changed from, it used to be, you would ask for a representative. Oh no, now they changed it to, I would like assistance. And it's like, it's ingrained in me to say representative.
I try to
And
get there as
now,
fast as I can.
and it's like they're slowing me down. And if they're really listening to you, they're not understanding that this stuff is ingrained with people for years and years and years. And a little tweak like that, we know when we talk to a representative, they are going to assist us.
Right.
So those little things just drive me bonkers, that I have to relearn, that have been working. I don't think just for me, but I think for people in general. And now, if everyone's going to do it a little bit differently, or calling into the pharmacy, this is CVS, I'll use them. I call into the pharmacy, and depending on what number I call, even if I call on the one on the bottle, it goes through this whole thing. And there should just be an option. I want to refill a prescription, but you have to go 3 deep.
Yeah.
To get that, which is asinine, because you're calling off the prescription bottle to begin with.
Yeah, absolutely. It's just, they make things difficult that don't need to be difficult. It could simplify things so much easier, make it a lot cleaner, a lot less messy. But for whatever reason, Lori, and I don't have the answer to that, they just keep trying to improve on things, but instead they're not improving it, they're making it worse.
Yeah. Well, and I don't know, and maybe I'm really wrong. And as a consumer, I need to be educated, but I would think most people call a pharmacy because of a prescription.
Right.
They're not calling to see, do you have this on the floor? Is my hair color in, or whatever? Is this on sale, or whatever? That's a need. And I know some people will call in. I know that they have to differentiate between providers and individuals.
Sure.
But that can be done really easy in the beginning with those 3 things. And then even with, hours, that's another important one. But you don't have to say all the hours up front. You can have a button to push. So it's cut to the chase, cut to the chase, cut to the chase, and get
Pick
where
the
you
day.
want to go.
Yeah, absolutely. Absolutely. Well, I'll tell you, we'd switched from the big retail pharmacies, and we use a local mom and pop pharmacy now. And it is so much less aggravation. You call, a person answers, what can we get for you? They fill it. They say, come over in 5 minutes. We'll have it ready. I mean, I had so much aggravation once. I had to get my daughter a prescription, and, she was like 5 or 6 at the time. And it's not a narcotic. It's not anything. It's not, a controlled substance of any nature. It was literally an antibiotic. I pull up to the drive-through because I'm doing this like in between appointments. How can we help you? I need to pick up a prescription, give my daughter's name. She comes back to the window. Can I get the date of birth? I give the date of birth. They say, can we have your license? I give them my license. They said, well, this doesn't say, your daughter's name on it. I'm not using my daughter's name intentionally. I'm like, that's because she's 6 years old. She goes, well, are you authorized? I said, I'm her like, it was so bizarre. I still don't know what the reason, because I never had that experience before. And then it got worked out, and she's like, okay, it's $25. I give them my health savings card. She gives it back to me. She says, now your balance is $5 that you owe. I go, why? She goes, well, I just took 20. I said, that's a health savings card. It's the same as a debit card, or, I said, pay all $25. Like, like this woman just was from another planet. I don't know, but I mean, it was a 45-minute drive through when there was no one else in line. I pulled right up to the window. It took 45 minutes. I'm skipping a lot of parts to get a
Yeah.
simple antibiotic. After that, I said to my wife, I said, we need to find a new pharmacy. I said, I don't know that I can mentally handle that again.
Yep.
And so we switched. But, I always suggest to people, just as a kind of a suggestion and a tip, if you're encountering issues with your, retailer pharmacy, look in your community for a privately owned mom and pop pharmacy.
Mhm.
They do such a great job. They have such great customer service, and they ironically end up having prescriptions in stock more regularly than your other pharmacies like your CVS and others do, because they deal directly with the supply chain one on one versus, a big corporation for all the locations in a state
Mhm.
or even in the country. They kind of, drip out the prescriptions. They only give
Mhm.
out so many to so many locations, and your privately owned ones you don't have to deal with that.
Mhm. Yeah. Well, I know we had a problem with medications, and they were saying that they weren't covered by Medicare, and it was diabetes medications which are covered by Medicare. And Tom was going round and round and round and round and round, and then they switched pharmacies, and it was like not a problem, But the other thing that I find is, and I have not figured this one out, that the same prescription can be different amounts at different time when I go in to refill. And I know, like, if the donut hole's been filled or not, and I can't figure it out. The other day I was really frustrated because, and I didn't know this, but CVS has a coupon that you can use for and I was told now it was only for things that aren't covered by insurance, but I know they've given us the discount on other things when it was covered by insurance. So the inconsistency
Inconsistencies.
drives me crazy. And yet there's, especially for our elders, when you've got your Medicare, and you've got your prescriptions, and you've got your supplemental insurance. I mean, there's so many different pieces of the pie. I don't even know how they figure out what to charge us, and who's paying what out of where, because it just seems so crazy. And then it changes every year on top of it, and kind of rotates. So we're going through now where and this is why I was on with the insurance company the other day, where medications have changed. Oh, we're not covering these. So now I had to get to the doctor and write them a note and saying they're not covering these, but here's three alternatives. And then trying to get the details of this. Happened to be for diabetic medication, of, is it a vial and a syringe? Is it a pen that has cartridges, or is it a disposable? In terms of what one you want to use. And I couldn't get the answers out of the person. And she's like, well, your doctor will know. And I'm like, I know the doctor will know, and he'll write what we need. But the question is it covered? And so it was like, oh, okay, I'm going to let go of that one. And we'll just do that in another step later. Because, and she was very patient, but she just didn't have all the information. And it's a huge difference, because the disposable pen's easy because you can just turn it, and they don't have to load anything. The cartridges, it's fine motor skills, and then it's a multiple layer of how to do that. And then the syringe and the vial, that's a whole nother level of what's needed. So yeah, and maybe it's because when people are older, a lot of them are taking more medications too, and then you have the side effects and the risks and the mixing. I really did appreciate one of the clinics that Tom was going to. Actually, he was meeting almost monthly with the pharmacist. They had a pharmacist to review exactly how are things going, and now we don't have to do that for 3 months because everything's pretty stable and stuff. But that I found very comforting, to really know what all these medications are for. And not that you can't Google them and stuff, but you get a deeper explanation, and then how they interact, and and those types of things. And so that was a really neat service. I know that people can go to the pharmacist and ask for a review. But I've also heard that they're really short of the type of pharmacists who can actually do those reviews. And it seems like the pharmacies are short staffed, just like
Yeah.
all the clinics are.
And I think that goes back to like my experience that I was sharing. I know a lot of our local, name brand pharmacies, if you will, they're desperately hiring like everywhere
Mhm.
it seems like these days. And I kind of contributed my situation and my encounter because this person
Yes.
obviously did not know about working in a pharmacy.
Mhm.
I was told they take a little training and then they just put them out there and now they're a pharmacy tech, which, to me, that's a little scary when you're dealing with these types of medications and, dealing with people's health and, is there a conflict? Is it contraindicated? And
Mhm.
so, I think that's a lot of it. I was just
Mhm.
thinking as you were talking, a lot of the major retail pharmacies, that we had worked with, you rarely ever have an encounter with the actual pharmacist. It's
Mhm.
usually just the upfront people because they're back there filling and just
Mhm.
nonstop filling. And I don't know that that's necessarily, kind of goes back to what we're saying about, personalized care. You
Mhm.
know, do you have a question for the pharmacist today?
Yep.
How many people say yes? A lot of them just want their script and get going because they've waited so long to get it. But I always tell people if you have questions, ask them, whether it's at your doctor's office, don't be afraid to speak up. If it's at your
Mhm.
pharmacy, if you have a question, speak up.
Mhm. Well, and the pharmacies have changed, so now you can get your shots there and you can do, and that pulls away from their core. I mean, I think back when I was younger, there wasn't a pharmacy on every corner. They're
Right.
kind of like gas stations almost now. And now we're hearing in the news they're cutting back. It's too much, it's too many. And it's not just pharmacy in basics. You can buy toys and makeup and, all kinds of jazz in there. Um, and so they're not the root of once what they once were, I don't think.
No, I
Um,
agree. I mean, I'm thinking even our grocery store here, they have a pharmacy in the grocery store now.
Yep.
Yeah.
Yep. Yeah, I know. Hy-Vee will give you like points or something, if you transfer everything over. And I've thought about that, and then it's like, oh, but I don't want to have to go in, and maybe there probably is a drive-through, and I just haven't bothered. But it's so much work to transfer everything
Right.
over too.
Yeah.
That's a whole nother thing. Like
And some
we,
medications you can't transfer either. You'd have to get a whole new script, which is
yep.
another step that makes it painful.
Well, and then when you do transfer, like, and again, this is, I don't have any, I don't take anything, so I'm very lucky. But I didn't realize this. It's like, okay, they're not all they're prescribing the same thing, but they get them from different manufacturers sometimes.
Yeah.
And so then it's like, okay, we got to use this bottle up because this is still good from the old one, but and then you can't mix them together, because they're different pills, and that'll get confusing a lot of times to who you're giving them to. And to even the person setting them up, it can be confusing. So it's like, okay, well, use this one first, and then we'll put this one away. But I ended up buying a whole like little carry-on bag for all the medications because there's so many of them,
Right.
and to keep them in order. And I set them up for a week, and I use those little manila like
Yeah. Little
key
envelope.
envelopes,
Yeah.
and I write the date and the time on them, and that works really, really slick because we were having too many problems with, I don't feel like taking that one today, or that really isn't helping, and then all of a sudden we're in the hospital and stuff. So I think there's so much that we can all share to hopefully avoid some of these detours and stuff that we've talked to. And it would be lovely to be able to talk to people in power that could really change some of this stuff.
Right.
And I don't know, maybe they do have little pilot groups where they get feedback from, but if you're just getting it from the general public, which I think is good, they may not be willing to talk about it, or they've forgotten about it until they get frustrated again with the process.
Absolutely.
And so pulling in, I think, some people like you and I that experience it as well from all sides, can help maybe streamline some of that stuff. I know when I was younger, I mean, I was kind of a jack of all trades in the healthcare industry I was in. So I always had to learn kind of from the ground up every department I went into. You know, you just don't make these changes. You really have to think of the impact on your patients and on your staff as well. And it can't just be driven by bottom line, you know, because a lot of these, I mean, you look at pretty much any of our healthcare institutions, they all say they're ready to implode. You know, they're not making enough money to cover their costs. And then what's going to happen?
Yeah, absolutely. And, well, and you mentioned it about the pharmacies. I know in our area, a lot of the main retail pharmacies have shuttered. They're closed, you know, and it just, I personally don't understand it because they're pharmacies and, they seem to be self-sufficient, but as many of them as closed, it's phenomenal to me. It really is.
Yep. Yep. Well, again, I think this has been an interesting conversation,
Always
and
is.
we'd love to hear from our listeners on your thoughts. What's working and what's not. From you, feel free to reach out and tell us your comments or put them on, the YouTube channel, so that other people can see them and track them as well. That's very helpful. Any last strategies that you want to give people who are, I mean, who's not in the healthcare,
Yeah.
bucket right now?
My biggest piece of advice always is, like I mentioned previously, if you aren't sure about something, if you have concerns about something, or you're confused, talk to your doctor. Don't be intimidated. Make them talk to you. And I'm not trying to beat up on doctors because I firmly believe this. I think they're all, for the most part, very good people, and they got into this to help people. But they don't know if you're confused or have a question or you're unsure about something unless you let them know. I think people get into that chair or get on that, gurney or whatever the case may be. And at the end, the doctor says, you all set? And people just, naturally say yes. And then they go out the door to their next room. If you don't know something, ask. And if you think of it after you leave, call and say, let the staff know you have a question that you really are concerned about. Same with your pharmacy. If you're unsure about medications or, anything like that, talk to the pharmacist. That's what they're there for, and, just keep yourself, engaged and educated and just up to date on your current, either your loved one's current health situation or your own. And anytime you have questions, just ask those questions of the healthcare professionals because they're the only ones at the end of the day that can give you the answer.
Yeah. And again, and if they can't give you the answer because paperwork has to be filled out, then, ask, how do I get this information?
Yeah.
And always know that you can give them information. That does not break HIPAA. You're
Right.
giving them information unless it's changed, but they can't maybe give out information to you.
Yeah. I'll leave our viewers and listeners with this. If you're not able to receive information because maybe you're not designated or they don't have the proper paperwork yet, we had a lady recently. She told the doctor, she says, I know you can't tell me anything, but I know I can tell you something. So just listen, and then you do what you want with that information, because she was concerned about her father's driving, and she was not the power of attorney. Her dad refused to give anybody that right, not even his own wife. And she says, but you need to hear this because I know you're seeing my dad tomorrow. And she gave him all this information, and, that can still be very effective as well.
Yeah. And sometimes you have to put your foot down. I know with my mom, this was years ago, the nurse is like, I can't talk to you. And I'm like, don't give me that. I know the rules. You better listen. You better take notes, and you better get this to the doctor.
Yeah.
Because otherwise you're going to hear from me on a whole nother level, and you're not going to like the legalities of that.
Yeah.
And then she listened. She still didn't follow through real good, but got the ball rolling. But, and sometimes you got to get stern, and you got to, and I mean, I don't like doing that, but I will.
Right.
You got somebody's life in your hand, or maybe it's your own. It doesn't make any difference. And I really encourage people, especially as they age, to bring somebody with you that you trust,
Right.
because sometimes you're not going to get all of the information, and it can be really overwhelming, especially if you're looking at get news of a new diagnosis. I mean, that's a lot.
That's a lot. Absolutely. Great advice,
So,
Lori.
well, thank you so much for having this conversation with me today
Absolutely.
on
Always
conscious
a joy.
caring. I think this I hope this, like I said, sparks some light for people in terms of what's working, what's not working, and how to deal with that. How to, you're not alone. Someone's not just being mean to you.
Absolutely.
It's not about that. It's our systems have some pretty major cracks right now, and we have to figure out how to fill them.
Absolutely. Could not agree more. Well, until next time, it's always good to have a conversation with you.
Bye, everyone.
Bye bye. Thank you for joining us again here this month at Conscious Caregiving with L&L, where we're tackling the tough conversations. We look forward to seeing you again here next month.